All right, welcome everyone, both in-person attendees and our virtual attendees. On behalf of the Natural Medicine Division, as you just heard, this meeting is being recorded and that recording will be posted on our Natural Medicine Division website. We aim to do that within 24 hours, but appreciate any flexibility you have and patience. Today is Wednesday, November 29th, 2023, and it is 1:02 p.m. My name is Allison Robinette. I serve as the Director of Policy and Regulatory Affairs for the Colorado Department of Revenue's Natural Medicine Division. Today, we are hosting our 7th session to inform our stand-up of the regulatory framework for natural medicine operations here in Colorado. Today's session continues our conversation about how the department will fulfill the statutory directives to collect and report data and create public education campaigns. I'm joined by my co-chair, Dominique Mendiola, the Senior Director for the division. We are also joined by our colleagues at the Department of Regulatory Agencies, including Lori Bratton and Sam Barami. Lori is the Program Manager for Natural Medicine Services in the Division of Professions and Occupations. And Sam is a Senior Advisor on Natural Medicine Services and has been working very closely with the Natural Medicine Advisory Board. We also have Advisory Board member Dr. Brad Connor in attendance today on behalf of the board. Joining us from the Colorado Department of Law, we have Ross Hooverhide, Christy DeMaria, and Paige Olson, who represent the division. We have 2 more sessions planned before the end of the year, which we'll cover before closing out today. And now I'm going to hand it over to Dominique to walk us through some logistics.
Great, thank you, Allison. Just another reminder for those new folks who have joined while we got started here, this meeting is being recorded. We have a packed agenda for today's session. We'll start our presentation today with data collection and reporting. We're excited to welcome colleagues from the Rocky Mountain Poison and Drug Safety Center and CU for presentations. Then we'll shift over to discussing public education campaigns. For our meeting today, the chat has been disabled so we can focus on our conversation here. When we open up the floor for discussion on either data collection or public education campaigns, we ask that you come off mute and introduce yourself, including your name and any organization you represent. I also just want to acknowledge and thank our in-person attendees. It's nice to see that grow over time, and I anticipate as we move into our formal rulemaking work that we'll see that generate a lot more in-person attendance, so we're excited about that. So some additional logistics here. If you are joining our Zoom meeting on the phone, you can raise and lower your hand by dialing *9. You can mute and unmute by dialing *6. We will be monitoring the queue to make sure we're reserving enough time for anyone who wants to make a comment. I'm also going to, this will be duplicative to things we've covered, but it's really important for us, to make sure that we are recapping just a quick touch point and overview of what Senate Bill 290 based on Proposition 122 provides. So we're going to cover that again here before we get into more of the substance based on our focus today. So for those of you who have attended our previous listening sessions, you will be familiar with this material. Under Proposition 122 and now Senate Bill 290, there are really 3 aspects to changes in the law here. First, on personal use. The law allows the personal use of natural medicines, including allowances for personal cultivation and possession. For personal cultivation, adults can cultivate natural medicine on private property, and that is defined in statute. That area must be enclosed and locked and cannot exceed 12 by 12 feet. It does not have to be contiguous. For personal possession and use, there is no personal possession limit. Also, adults are allowed to share with other adults, so all over the age of 21, for reasons listed in statute. For example, within the context of spiritual guidance and community-based use. There are also restrictions and prohibitions on personal use established under state law. For example, when sharing, you cannot accept payment for natural medicine. This is not a commercial program, as you will not see dispensaries for natural medicine like we have here in cannabis here in Colorado. Second, as it relates to a regulatory program for natural medicine, the law directs the Department of Regulatory Agencies, so that's DORA, to license and regulate facilitators, persons approved by the state to administer natural medicine to adults in a regulated environment. And third, the law directs the Department of Revenue to license and regulate healing centers, cultivations, manufacturers, and laboratory testing facilities. Other assigned responsibilities include things that we're going to be covering here today, like data collection and reporting, and the development of public education and first responder training materials. That's just to name a few. In previous sessions, we provided more background and detail about the department's responsibility under the Natural Medicine Code. All those meetings are recorded and available on our Natural Medicine Division website. So just know that that information is available to you, along with meeting materials like our agenda and slide decks, and other resources that we've created, including a summary of Senate Bill 290 that we developed to support our implementation work. So please take advantage of those resources that we've made available to you all. And for purposes of today, we're focusing on data collection, reporting, and public education. All right, Allison.
Right, thank you, Dominique. And bear with me, I was dropping links into the chat, so I need to catch up with where we're at. All right, so we're going to start with an overview of the data collection and reporting requirements adopted in Senate Bill 23-290. This is the first forum that we are talking about this with a broad group of stakeholders. And so we're really interested in any feedback you have on the items we're going to present. And so we'll start with what Senate Bill 290 mandated the Department of Revenue collect regarding relevant data to natural medicine products, and natural medicine businesses. And that includes law enforcement incidences, adverse health events, impacts to healthcare systems, consumer protection claims, and behavioral health impacts. Because of the broadness of the statutory mandate to collect data, we started our work by engaging other state agencies to better understand what data the state already has, if it's being reported publicly, and if there's a way that we can really leverage that expertise already built into the state system. This is driven in part by our experience in the cannabis space and understanding with greater clarity those data sets we rely on now in regulating cannabis that were not initially established with regulatory framework. And so how can we use those lessons learned as we establish this new framework? And it's also important to recognize that this responsibility spans both the personal use space and that of the regulated space under the Department of Revenue, Department of Regulatory Agencies, and the Department of Public Health and Environment. And so that's, a broad topic area that we're starting with here. Through these discussions, our partners have highlighted valuable resources. And so I'm going to highlight a few of those. One that we are aware of is the Colorado Crime Statistics Dashboard that is produced by the Colorado Bureau of Investigation. And that specifically includes a data set related to hallucinogenics, not necessarily delineated by specific substances like in Senate Bill 290. And this dashboard, for example, will be useful as we look to better understand how we collect and report data related to law enforcement incidences. We also know that our colleagues at the Behavioral Health Administration have established complaint reporting to collect information around critical incidents, such as adverse health events. And similarly, the Attorney General's office has an established system for collecting consumer protection claims. So establishing these connections with our state partners and other organizations will help us at the division further evaluate and leverage these existing systems. So moving into how we're approaching this initial implementation. Given the preliminary work and what we've learned so far, we wanted to start thinking about how are we going to approach our initial implementation. And so we welcome your feedback on any of these topics or items today. First, we see value in further defining the scope of these broad data categories. It's clear that we will need to further define the scope because, again, law enforcement incidences, adverse health events, consumer protection claims, healthcare system impacts, behavioral health impacts, there's going to be a lot of nuance within these broader categories. For example, when we think about law enforcement incidents, can we and should we further define this to be more specific, such as focusing on impaired driving stops and enforcement versus law enforcement responses to emergency calls, law enforcement responses to healing centers versus not healing centers. in situations where alternative responders, such as mental health responders, are the ones responding to emergency calls. And by way of further example, how are we creating buckets for the broad category of impacts to healthcare systems to zero in on the data, including hospitals or healthcare providers that also obtain healing center licenses as permitted under the law, and any trends we can identify in the numbers or rates of folks accessing natural medicine services in conjunction with other mental health services or services such as addiction recovery. So all of this will help inform how we can leverage existing data and data collection methods. So similar to what I just outlined as our work with other state agencies, we're looking at other organizations that may be doing data collection work as well. This coordination will absolutely be key for the state to be successful in collecting and reporting data. And then another area that we also are speaking about and thinking about are how can we identify the gaps in existing data and those sort of nice to have data areas. In addition to the specified categories, there are other data points that we know there is interest and value in collecting, which could include just general demographic data about participants utilizing regulated natural medicine services, access to natural medicine at healing centers, common doses of natural medicines, side effects, benefits, and adverse health events that may help inform selection and use of natural medicine, whether through regulated or personal use. So lots of different areas and lots of different pathways we can pursue in this, this mandate. As we look forward to our ongoing implementation, we're keeping in mind analyzing future needs for resources. So as a reminder, for now, there's no specific funding under Senate Bill 290 for the implementation of data collection and reporting, which in part informed our initial work to see what data is already being collected and reported so that we can see where we can just leverage those resources already in use. Mm-hmm. And as we think about areas for data collection that may not be specifically outlined in the bill, we also have our eye toward what type of funding will be needed to implement that broader data collection. And how can we create an environment where statutory and regulatory changes in the future are both data and science driven. So as we think about this, of course, we'll be reporting on our implementation of this work. And we anticipate that in addition to our annual reporting, there's value in more real-time data reporting, such as how we've established public-facing dashboards. For example, the Colorado Bureau of Investigation. We've also previously shared the Marijuana Enforcement Division data dashboard, which is useful. So how can we really think about de-identified and aggregated data that's being made available to the public in a real-time basis? So with that background, I'm really excited. We have two guest speakers that are going to present today on data collection perspectives and opportunities. We will hear first from Dr. Andrew Monti with the Rocky Mountain Poison and Drug Safety Center and the Colorado School of Medicine. And then we'll hear from Dr. Scott Thompson with CU Anschutz. Dr. Monti and Dr. Thompson are both happy to answer any questions. So if you do have questions, I'll ask that you hold those until after both presentations, and then we'll open up for a Q&A. So we'll go first to Dr. Monti, and if you'll give me just 1 minute, I can get your presentation shared.
Actually, I have a presentation here. I can share it from my own computer if you can just enable it.
Absolutely. You should be able to.
Perfect. There we go. Thank you so much for the time, and I'll get things going. Hopefully you should be seeing my slides momentarily here. You can see them?
Yes, we can.
Perfect. Thanks so much, Allison and Dominique. So I'll just spend a little bit of time here and talk a little bit about data collection and the reasons behind this. So thank you for the introduction, but I work at Rocky Mountain Poison and Drug Safety and the University of Colorado, and I've worked on data collection for substance use as well as safety of medications really for my entire career. So, you know, everyone has seen more and more about psychedelics in the news lately. There have been publications that are starting to come out more and more. And you'll see, you know, famous people popping up in the news with their own opinions, of course. You know, of course, Aaron Rodgers is a real proponent of this use, and actually it's really helped him, he's felt. You know, but you're going to be seeing this on all sorts of different platforms, including news organizations, popular personalities, And then these types of instances where really there's going to be a framing and blaming of the drugs for adverse events. And, this, if others didn't see this pilot had used mushrooms 2 days prior and then blamed his ongoing confusion for trying to open the door on the plane a couple of days later. So, there are all these instances that are going to pop up in the news, and actually Colorado is going to be really part of those stories quite a bit. And so we want to be leading from the front and making sure that we have data to justify the decisions that are made here. I think everybody also knows this on the call, likely if you're on here, but research was really suppressed for 40 years after the US Controlled Substances Act. And so there was really not much in the way of medical use publication on this and the research. And so I think that that's really important to understand why that was. And so as we talk through here, this here is Art Linkletter, and people may know who Art Linkletter was, but he was a popular TV personality in the 60s and 70s. And so unfortunately what happened is his daughter, Diane Linkletter, died by suicide actually, and Art blamed LSD as the reason why. So this happened in 1969, and really what happened was Art went into the White House afterward, and this was a story that galvanized the public against LSD use. And really, again, this was one of the reasons why there was suppression of research for 40 years when this was made a Schedule I drug under the Controlled Substances Act. And really also, this was the start of the war on drugs. Now, it's important to note that Diane Linkletter actually had no drugs in her system when she died by suicide. And in fact, actually, her boyfriend was on at her house the day before and said, hey, listen, there was actually no drug use here, but that didn't matter after the story was out there. And Art later went forward and talked about it and said, oh yeah, well, this was an acid flashback. And, this is the type of story that can actually really harm a product and the availability of a product that could potentially help people. My clinical practice is in medical toxicology, and so I take care of patients with mental health conditions on a regular basis as part of my clinical practice, and we clearly need better drugs for that. And so we need to maximize availability, but of course, maximize safety of these things as well. So you have to collect data on all parts of the program. The state's done a really nice job of outlining some of those areas that need to be collected on, because if you only have data on hospitalizations, it looks like all the effects are negative, right? If you only have sales data, then you just understand what positives are from a financial standpoint. But realistically, you need to look at all of the different data sources in order to understand the entire picture. And that's going to be really important here for psilocybin, as well as other drugs that may be rolled into this going forward. And the reason for that is because inherently there are patients that will have adverse events, but you want to put adverse events in a perspective of all the positives that are happening with in the state from the program as well. And so these are the areas that you just saw Allison go over around all the elements that are statutes within the law, right? To measure things on behavioral health impacts, health system impacts, financial impacts, law enforcement incidents, consumer protection claims. And I was really happy to hear that the state actually has a couple of potential sources for these data, which would be really helpful. I've actually put in italicized a couple of other things here, but I actually really believe that access to care is going to be an important element here, because the problem is if there's low access to products and care here, then things can be used in ways that are not approved, and actually that may be more dangerous. So if you look at the map on the right, these are maps of actually ketamine infusion centers, and you can see they're really focused around population centers, and that is likely to happen here with healing centers as well. And so we actually do need to be able to capture access as part of this so that we can measure if adverse events are happening with use outside of access. We have to address things that are of importance to public health and newsworthy events, because there will be somebody that unfortunately commits suicide. And you need to have the other data that's saying, hey, listen, this is actually lower than the rate that happens in the rest of the population, for instance, as an example. So you need to triangulate those types of things. This is what happened with cannabis, and I will say that this is going to happen with psilocybin as well. As availability increases of any drug, the reported rates of events is going to increase. So on the left-hand side, you can see actually the use increasing in Colorado and Washington. And then on the right, these are data from our own state here, where we saw poison center rates increase here, and you can see them marked by as availability increased. We already know that use is rising here in Colorado. We've demonstrated these data through our own national surveys that look at all sorts of different medication as well as other drug use in the country. This survey looks at 60,000 people across the country every year, and really does measure, allows you to measure what the rates are of use in Colorado versus other states. And so these data here in the green are Colorado and Oregon, and we see a massive rise of use, of course, after some of the liberalization of policies. We already know this is happening. These are actually the total psilocybin cases called the Rocky Mountain Poison Center by year. And you see these are going up, and we're only through October for 2023. And you're seeing that these rates are already increasing. So, the bottom line is that we're already seeing these cases. And I'll just give you an example of some of the cases that we're already hearing about from the Poison Center. This is a de-identified case that we've just taken a look at, but this unfortunate person took 5 grams of psilocybin chocolate bar and was naked in the street running into traffic, right? And this could have actually ended up in a really negative outcome for this particular patient, and is the type of thing that can really actually harm a program if you don't have additional data to sort of understand what the benefits are of the program as well. Cases will rise. You have to understand whether or not these things are used under the approved state program, or if these things are being used in unapproved ways as well. And so I think this case highlights that we actually can't tell from this particular case exactly how that happened. The bottom line is that there are a lot of unknowns, right? What are the differences in ER visits between approved medical use and unapproved users? What's the prevalence of suicidality? What's the rate of driving under the influence? How long does treatment last? There's a whole lot of things that we don't know that we actually, Colorado can be a leader in providing this information, and actually it helps mitigate any potential risk to patients, but then also maximizing availability for, really legitimate uses of these drugs. So, data sources, these are things that data sources must do in order to be of use to the state, as well as to the consumers that are using these things. Data have to be available relatively expeditiously. There are many national surveys that actually don't provide data back to the state for a couple of years. And for a new program that's going to have a lot of emergent behaviors, you want to have data rapidly. You have to be flexible to add questions that are important. That's really important, because things are going to pop up and you want to be able to have data on them so that you understand whether or not it's a problem or not. You need to differentiate products that are actually happening through approved processes versus unapproved and or the quote unquote bad actors, so to speak. So you really must be able to do this. You have to be able to identify regional differences for some of the reasons that we talked about before, which is largely access to care and really what's happening in different areas where behavioral patterns may actually change. You have to demonstrate effectiveness. I've talked about this a couple of times here, but this is really how you're going to help demonstrate that this is a benefit to the state overall as this program moves forward. Of course, everybody I think agrees that you have to assess safety. You have to answer questions that consumers have, because there will be quite a bit of questions from patients as well as other consumers utilizing for celebratory purposes. you got to do this in a cost-effective manner, because as Allison and Dominique have mentioned, really there's not dollars set aside for this per se. So all this stuff has to be done in a really cost-effective way. And probably the most important piece here, this has to be done in a confidential way, because we have to realize that legitimate and safe use has been happening for decades, really, right? And so, we do not want to put patients and users in a bad situation because they want to talk about what's going well and what isn't, because really what we want is for the people that have been doing this for so long to be able to educate the public on how to do this well. So a little bit more about Rocky Mountain. We've actually been doing this for 70 years at Rocky Mountain. We are the Poison Center, but we also do a lot of research on substance use, as well as safety around medications, right? And so, we utilize a mosaic data system because of the issues that I described, in that we want to make sure to tell the whole story here, and not just bad effects and not just good effects either, and not just the financial effects. So we have access to mortality data. We look at acute health effects through Poison Center data, but as well as through our surveys that have validated outcomes to measure things like mental health improvement. We look at substance use treatment outcomes. We actually do this large population survey that I've already talked about a little bit. Looking at drug diversion outside of the state will be important. Looking at street prices when this stuff happens, and looking at web discussion are all tools that we've utilized in the past. Our work has actually been used by a lot of federal organizations just for summary data. We always just provide summary data to any of these groups. And in fact, actually, we are really cautious and cognizant to only capture what is needed, and we don't get personal health information for the vast majority of the things we do, and we would never share that stuff. So what are we doing in this particular space? We have developed a focused survey called the National Surveillance Investigating Hallucinogen Trends, which is a survey of psychedelic users across the country. And so this methodology builds upon our other work, and allows us to do comparisons across different states so that we can see what behaviors and what outcome trends are happening in Colorado versus other states as well. We also have a tool for healing centers, actually, that we are currently piloting amongst esketamine and ketamine clinics, which is a little bit different of a population. But we've actually, we're piloting this through a phone application that will allow us to collect data from patients so that they can tell us what's important as well. Of course, we've got the Poison Center data, and Rocky Mountain has always served to actually take product complaints so that we can understand if there are other consumer issues that pop up. We do this for dozens of pharmaceutical companies across the country, as well as a couple of other groups as well. And in fact, actually, we served as a source for COVID data as well for the state in the past. I'm also going to let Crystal Gooddeal talk about things here as well, because she's put a lot of work into understanding what's important to consumers and the population at large. So Crystal, are you on?
Yes, I am on. Can you guys hear me?
Yes, we can. Go ahead, Crystal.
Okay, excellent. Sir, I will apologize in advance for the sounds around me. I'm actually at a conference right now in Las Vegas. It's all about psychedelic medicine. And one thing I'll mention first is that there is a lot of recognition and applauding going on of Colorado and what we're doing, and that we're kind of building the framework. We're the first to do something of this type in the way in which we're going about it. So kudos to all the Coloradans here for what we're doing collectively. So as Andrew mentioned, there's a couple of things that are really important that we're trying to capture that's beyond just the traditional data, the objective data and the numbers. And I bring in kind of a unique perspective with my role. Is I come from the pharmaceutical industry. So my background is working with the medications, one of which Andrew mentioned being esketamine, and working with the treatment sites, many of which have an interest in integrating natural medicine within their practice. And one of the things that's most important for us to understand is what is the voice of the customer, the people that intend to consume these products and facilitate the use of them, what's important to them, because that's what's important to us. So much of the work that I've done is meeting with focus groups and meeting with practitioners and speaking with those that are operating underground as well as in medical clinics to understand what are the risks that they're concerned about, what are the fears, what are the known and unknown adverse events or conditions that we could anticipate, and how do we appropriately capture the important information and then turn that into data that is actionable. So these conversations have helped us inform the development of not only the insight survey, but also within this pilot project that we're rolling out, so that we can make sure that what we capture is actually applicable and relevant and can be part of as we build this future moving forward with Colorado and the Natural Medicine Act. So I'm encouraged by what we're doing. I also feel that the insights coming from Rocky Mountain, as well as my background in the pharmaceutical industry, much of my focus in previous roles was related to patient access. And one of the things that we're cognizant of is that access can be a limiting factor for a variety of different reasons, and access has different definitions depending on who the consumer is and what type of treatment setting we're talking about. And when it comes to esketamine, the first FDA-approved drug in the psychedelic realm for it's actually ketamine, I helped create that patient access pathway. And my team was dedicated to finding billing structures and billing and coding processes that would allow patients to have this product paid for. And I realized that we're not moving towards that at this point, but my understanding of the risk mitigation process and the needs of making sure this is safe and available and enabling access is something that I have a lot of background and experience in, but most importantly, I have passion towards what we're doing. And so I'm grateful for the few minutes you've given me to offer some insights. And Dr. Monty, I'll pass it back to you, but it's great to be a part of this initiative, and we're really setting the groundwork for the future.
Yeah, thanks, Crystal. I think it's really important perspective, and right, really a lot of what we talk about is really trying to identify what's important to consumers, but then also helping to differentiate where the bad actors come in here, which is going to be critical for the state moving forward. I'll just say that our systems actually can do data on the county level, and so that you can actually see what's happening regionally. This will help you with access. It'll also help when you sort of lump data like this, then you make sure to preserve any confidentiality. I'll say that we're also working with the group in Oregon in order to understand how our data relate to their use as well, because they do have, that's part of their work is funded by the Substance Abuse and Mental Health Services Administration in order to understand what the outcomes are of people in healing centers in Oregon that they're calling service centers. So we hope to learn from them, and they will learn from us as well in order to make this an effective program. I'll briefly just touch on public health education. Rocky Mountain Poison Center has always been willing and able to help in education as these things come in. So we can provide information to patients in Colorado. We will always make sure any messaging that we're going to give must be advised by data, because we're not just going to be making things up. And I think really the goal here of the state is the same. We must address areas that are of importance to consumers, and so that's hopefully something that we can help provide through Poison Center as needed, even if it's just an information. Hey, can I take this drug with this particular medication, and those types of questions. Literature searches had been really useful for cannabis because there was a large body of literature. But really, because of the last 40-year suppression of research, there's not nearly as much research out there. So eventually, literature will be important going forward. But I would say that we are going to be making a lot of this literature. So the data that you generate will be the data that ultimately advises programs in other states going forward. And so be cognizant of that, and also don't expect to find answers to our questions in the literature, because frankly, I just don't think you're going to find a large body, having done a fair amount of literature searches on this topic in the past. So just in summary, I would argue that a lack of data is a real threat to this program. Questions will arise, and so you should be thoughtful about the questions that you ask and the sources of data that come in there. I will say that there's going to be limitations of certain data sets, such as hospital data, for instance, can have issues because there are no real good ICD codes for psilocybin. And unfortunately, if you have ICD codes for altered mental status and somebody marks down that they've used psilocybin back in 1960, that may end up in your data set, even though their confusion because they've got a urinary tract infection has nothing to do with that. We saw that with cannabis. So you actually have to be really cautious about the data and the validation of the data as you go forward. But these data sources have to be fast and flexible, right? And they have to characterize both safety and effectiveness. Really, we have to focus on questions that are of importance to users. And we're really just qualified and ready to help. I will also then turn things over to Scott Thompson, who's going to give a talk here on the data that University of Colorado has access to. And really, they have a real capacity to provide some of these data, and they've got better methods and mechanisms to process some of those data to hopefully get over some of the issues that I've suggested here. So my hope here is that this will be a collaborative data collection effort from the state as well as other respected members of the community, such as Rocky Mountain and University of Colorado. But let me turn things over to Scott. Dr. Thompson.
Hello, everybody. Allison, can you please show my couple slides?
Absolutely.
And while you're doing that, I'll introduce myself. My name is Scott Thompson. I'm a PhD neuroscientist and also a professor in the Department of Psychiatry. I have been interested in psychedelic medicine and its potential for treating psychiatric diseases for many years. And we are currently leading one of the first trials for psilocybin in the Department of Psychiatry under the lead of Dr. Andy Novick to treat depression symptoms. So I am here today representing a group of about 90 healthcare and researcher professionals associated with CU Anschutz and some of our sister campuses around the state. And what I'm going to present today is a sort of a synthesis of some of the things that many of us have been thinking about this data collection process as mandated by the state law. And in particular, as we just heard really well presented by Dr. Monte, there is sort of statewide global level data that is important to informing how we move forward with psychedelic medicine. And what I would like to talk about today is a subset of that's really focused on the individual participants, the people that show up in the regulated process looking to improve their mental health. And so I think it's clear that the state has authority to gather behavioral health impacts, and in particular, the topics that the law mandates that we gather data on are related to issues of efficacy and regulation, product safety, and harm reduction. And we just heard a lot about that from Dr. Monte. But that's also true at the level of the individual participants. And so in all of the carefully controlled academic medical center type studies of psychedelic medicine that have been performed in the last 6 or 7 years, really is the current wave, we have treated only a few hundred patients because our screening procedures are incredibly stringent. We exclude lots of people. We do these under very, sort of laboratory conditions. And the reason that I'm here today is I'm incredibly excited about the opportunities that we will have here in Colorado to learn more about the right way to use these powerful medicines to improve human health. And so again, this is really a massive opportunity. Within 1 year, we will treat here in Colorado more participants with psychedelic medicines than by far than all of the academic studies that have been done to date. And so we really need to learn from this experience as best we can so that we can answer a whole host of questions that we just haven't been able to answer in the academic environment. For example, we don't know which psychedelic medicines are best for which sort of mental health conditions that people are likely to want to be treated with psychedelic medicines for. Is psilocybin best? Is ibogaine best? Some of these other compounds that we'll soon have here under the Psychedelic Medicines Act. We don't know what doses to use for different conditions. Can we use lower doses for some conditions and maybe make people able to leave the healing centers sooner than they would if they got a higher dose? Does that matter how old the participant is, what condition they're suffering from, what their life experiences have been? These are all completely unanswered questions at the moment. Is one administration of a psychedelic enough, or do we need to bring participants back for multiple dosing sessions? Would that produce a better outcome than a single dosing session? Again, no data whatsoever anywhere right now. And a particularly important issue that Dr. Monte touched on is we need to demonstrate to the state and to the public that these medicines are safe and effective. And a particularly important aspect of that is demonstrating that these medicines are actually cost effective. Ultimately, if we want to see the benefits of these compounds maximized for Coloradans, we really need insurance companies and other healthcare provider systems, Medicare, Medicaid, to be picking up the cost of treatment with psychedelic medicines. In order to do that, we have to demonstrate to them, and we have the opportunity to demonstrate to them, that this is an incredibly cost-effective way to treat mental health in the state. And so how can we do that? Again, we have the mandate that we can collect health data from participants in the natural medicines program. We can, if we gather this information carefully, we can learn a lot about the safe and effective ways to best treat mental health issues with these medications. We can do that in a data-informed way under real-world conditions with patients coming in from all sorts of backgrounds around the state. As Dr. Monte mentioned, we, in order to maximize the benefits of this data, we need to be able to get it back in the hands of the healthcare providers. And so, as he discussed, we need to have the ability to gather these data, digest them, and return them back to the public and to the healthcare system as quickly as possible. We think it's also important that the participants be actively engaged in this process, because community and social interactions are an important part of the healing process, we believe. And we think that by engaging the participants, by explaining to them how it benefits not only them, but also other people in their position around the state, that we can engage them and get the best data we can gather to improve the healthcare process and the natural medicine process. So again, the primary goal, of course, better healthcare for Coloradans. There are some other real goals that will come out of this. We will advance the reputation of our universities and scientific communities by gathering these novel data and analyzing them and publishing them for their medical, their economic, and their policy implications, and advancing what we learn here in Colorado to other states around the country that are currently considering liberalization of psychedelic medicines, and other countries as well. So we have a real opportunity to be at the forefront, not only in the delivery of these products to our citizens, but also into learning from the experience of our citizens as they use these processes. And of course, it's an essential part of the harm reduction process. We need to make sure that all of the providers are up to our standards, that they are meeting the standards that the Natural Medicine Division establishes. We need to be sure that we are not creating a burden on our police and emergency medical systems, that they are prepared for what might come their way. And the best way to do that is to learn from our experiences as we go forward. Can I have the next slide, please, Allison? So we have been thinking about this for a while, and we've come up with some ideas of what a data collection plan might look like. Again, this is a data collection plan focused on the individual participant in the natural medicines program. And so we want to collect an integrative data set that links together the participant and the facilitator under the regulated natural medicines part of the plan, as well as the supplier of the natural medicine that they used in their process. If we do that in the most integrated way possible, we have the greatest opportunity to detect discrepancies, problems, and as Andrew mentioned, bad actors potentially as well. So in order to do this, it's important that we make sure that the data collection process is not a hindrance. So we need to design a data collection plan that minimizes barriers. As Dr. Monte mentioned, this is probably a phone and computer-based input of data stored up in the cloud for access for analysis later on. Again, everybody's got a phone in their pocket, everybody's got a computer on their desk or table, and we can design a system that will be very easy to use while maintaining the very important issue of privacy and anonymization. So it's important that when we build this system that we can protect all the information that the participants and the facilitators are giving to us. And we need to make sure that once we have it, that we don't allow any unauthorized access or corruption or theft of the data as we use it. And so again, the best way to do that is a web-based collection and storage kind of system. We also need to make sure that the data we collect updates the database on a regular basis, and so that it's available then for real-time analysis. And we need to make sure that the data that we provide for any analysis is fully anonymized, and that the privacy of our participants and providers is again protected. We would like to suggest that, of course, participants providing us this data is a gift, and we need to respect their privacy. We need to earn their trust. And we think one of the institutions that's best trusted by Coloradans is the University of Colorado system. We at the School of Medicine have all of the necessary expertise for analyzing both the data, both from a healthcare perspective and from a policy perspective as well. And we have a lot of great partners, not least of which would be Rocky Mountain Poison and Data Safety Center and other University of Colorado system schools. And again, we see this as a public benefit that we are providing for the state, which is clearly well within the mission of the University of Colorado system. Come to the next slide, please. So there's a lot to discuss. There are a lot of different ways this can go. I'd just like to highlight two of them here that need to be considered kind of at the outset. The first is really how much to collect. I mean, the state law gives us a mandate to collect data, but it doesn't really say how much. We want to make sure that it's not a burden. So, one could imagine that there is a core of essential data that we would collect, and I'll show you some examples of what that might be in a second. But the more information that we can get from the participants, the facilitators, and the providers, the better our ability to provide answers to outstanding questions. And so one option here, which would increase the burden but increase the quality of the data, and hence therefore may be sort of an opt-in option for the participants, would be to encourage people to engage with the data collection software in a more in-depth manner, spending more time answering questions, more detailed questions. That of course, the more and better data we collect, the more and better conclusions we can draw from that data. So there are options there that will need to be considered. And of course, as Allison led off with, there's an important question about how we fund this data collection and analysis process. There are costs associated with developing the software, maintaining the software, making sure that every time your Apple phone updates, that it's still able to communicate with the database. We need to have human beings that are there performing the oversight and the analysis, and of course that involves labor costs as well. So again, one suggestion for how to do this amongst many possible ways to cover the cost would be to acknowledge that the data that we collect through this process has value, particularly the in-depth data. And that has value not only in a sort of an academic, non-monetary system, but also, as you probably are well aware, there is a huge effort going on around the world right now to develop novel psychedelic medicines, and it's likely that the data that we collect here in Colorado would be valuable to these non-public, non-academic users. And so one could imagine a system where those users would pay a heavy enough fee to access the data that could underwrite the costs of the public benefit analysis of the data as well. Again, there are other ways to do that, but that's one suggestion. Could I have the last slide, please, Allison? So I just want to leave this up here. This is a sort of the kinds of questions that one could ask through this survey. What we imagine is that the participants would enter a set of baseline data prior to their dosing session. So that would be the sort of the introductory session. And again, this is through the regulated pathway. These are the kinds of questions that would provide useful information for improving the process down the road. We need to use this data to ensure that the natural medicines are reaching the public in an equitable way. So we need to know something about their identity. We'd like to know something about the conditions that led them to seek to use natural medicines. So a variety of questions could be asked that get into that in a way that can be answered in a useful fashion by members of the general public without medical training. We have the ability to do that, the experience. We'd like to know something about why they're choosing the natural medicine path. So what is their insurance status? Is this seen as a cost-effective way compared to what their insurance is covering? And again, we'd like to know a lot more about what their status is as they enter into this natural medicines process. Are they drug naive? Have they had prior drug experience? And again, from a safety perspective, we need to know as much as we can about their prior mental illness, both the participant and the participant's family members. And it would also be really beneficial to know something about the current medications they're on, since many of these psychotropic medications that they may be on for mental illness have direct interactions with the target of psychedelic medicines as well. And so somebody who's taking a psychotropic medicine may benefit best from a different dose or a different dosing regime than somebody who is not on any other psychotropic medication. So that would provide us the baseline, and then we'd like to know whether they benefit, how much they benefit, in what ways they benefit. And so it would be really useful to ask them a set of follow-up questions, beginning with their integration session after dosing. How do they feel? Same sort of questions that we asked at baseline, so that we can get an idea of whether their mental health improved. It's also really useful to know something about the actual psychedelic experience itself, again, by way of optimizing the dosing for people of different ages and body sizes and starting conditions. We would also find it beneficial, I think, from a safety perspective, to have real-time data from individual patients about the particular facilitator that they used for their experience. Again, we want to make sure that everybody is delivering these powerful medications in the best way possible. And again, it'd be really great if we could follow this data up over a long period of time. In academic studies, the benefits of a single administration of psychedelic medicines has been shown to persist for up to a year. That's a small sample of about 20 subjects. And so if we can get that same quality of information for the hundreds and hundreds of participants here in Colorado. Again, we can really have a massive worldwide impact on establishing the safety and efficacy of psychedelic medicines. I mentioned before that it's really important to integrate this kind of patient level data with the healing centers where they receive their treatment. And so it would be really great to know, of course, the individual facilitator, who that is, but also where they got their the medicines that they are providing, the dose, the manufacturer, the lot number, the fresh sale date, all those kinds of things that help us to ensure the safety of the medicines that we're providing to our participants. We'd like to have an independent rating on how they seem to have experienced the medicine. And they're also well positioned to provide us with safety data about adverse events during the dosing session. Did they have a bad trip? Did they have a bad experience as opposed to a challenging experience? Was it necessary to call in emergency medical assistance or police assistance? I know there's a lot of fears in the wider public, having spoken to the Colorado County Commissioners about demand on the emergency medical system. So this just gives a sort of a quick snapshot of the kinds of information we're talking here and how it will impact our ability to deliver the best possible and the safest natural medicines to the Colorado. Thank you.
Thank you so much, Dr. Thompson and Dr. Monte. Really appreciate that. Because you both indicated you were open to answering questions, I'd like to invite any attendees, either in person or virtually, who have questions to go ahead and raise your hand. And I see Nico, go ahead.
Howdy. Thank you all for putting this together, and I really appreciate the presentations we just heard. One of the concerns that came up for me was really around the government in general collecting this type of sensitive data. And so I think it would, well, I don't want the capture of the requirements to capture data to prevent any potential participants from choosing or even hesitating in choosing this type of therapy. And it seems like the speakers were proposing that there'd be third-party organizations who are the actual custodians of these data rather than a government agency. I don't believe that our participants will differentiate between state and federal government when they're thinking about where their data goes. And with the federal, with it still being federally illegal, I imagine that will potentially prevent people from wanting to take part. So along those lines, beyond having an independent group managing the data, I think it's also useful for us to be thinking about allowing users to opt out of such data collection, especially data collection that includes PHI. I don't even know if PHI is the consistent term here, with these not being patients and not being covered by HIPAA. So that brings up another point around, should we actually, as a division, be thinking about creating a bill of rights of sorts for these types of participants, and what rights they have around the utilization of the data, and what parties have access to it, especially identifiable data, and being able to opt out of that collection, but to also consider the amazing benefits that both Dr. Thompson and Dr. Monte spoke about. I think it would behoove us to create an opportunity for participants to opt in to providing even more data if they would like to participate in these types of research. And that, of course, would include great user experience, as well as benefit from the data directly. So rather than just sending data into this cloud and hoping that it benefits someone, being able to have features that provide them direct benefit. So I just wanted to bring up those points of questions and concerns around this approach here. But thank you.
Just to piggyback off what was just said, I thought too about like a self-reporting funnel for folks and using a third party, kind of like you talked about, because just like what he said, the trust and everything is just going to be essential, I think, to have that, that buffer between any government agency. And I think there's a lot of potential to just ask people, like, are you willing to give information right now today. I bet you there's a ton. I'm also interested if you guys would fish for how many licenses are people interested in applying for. I'm sure there's an intent here. And so I'm like on a data side, also interested in supply and demand and what happens when these licenses drop, and are we prepared to fulfill that promise of, I wrote it down. Like delivering it to as many people as possible, like getting it actually out. Are we going to be able to connect the right providers with the right populations?
Thank you.
Yeah, I think again, by encouraging people to opt in, we gather the biggest database we possibly can. I do think there are some healing benefits to feeling like you're part of a community. And one of the conversations we had, which as an old guy here was really enlightening, was to remember that the younger generation in particular is very socially engaged. They want to do good, and they also want to be part of a community. And I think there's that offers a benefit that will encourage a lot of people to opt in for deep data collection.
Thank you, Dr. Thompson. So I think I see some other hands up, so we can go back and forth if there are in-person questions as well. And just a couple things I wanted to note. Nico, you did raise some important considerations that we're going to have to dig into further. Example being, the authorized custodian of data. What does the law direct? If there are other pathways that we see as valuable, and also assessing the various risks of different pathways. How does that inform recommendations we're making if we see, and identifying what constraints we might have around that. So all things that are important for us to be continuing to think about. I like the idea of considering surveys around the openness to providing information around these things, as well as what work are we doing to inform as we stand up a regulatory program, the number of licenses we can, prospective applicants we can expect to come forward. And through these listening sessions, as well as the rulemaking we'll be engaging in, that's going to be a part of our, seeing how we can gauge that information and provide updates on, here's what we're seeing so far. And leveraging surveys where we see opportunity to do that. And just a reminder, because I expect through our listening sessions, as well as we get into our formal rulemaking, we'll probably continue to see very familiar faces and spend a lot of time together. So let's make sure we are putting names to faces, and so sharing who you are and who you represent each time, so that we can make sure that we're all becoming more familiar with one another. So do we want to go to Mason?
Can I just say, it sounds like Crystal already has established or is establishing a set of listening opportunities where we could start asking these questions that we've been discussing here today.
Yes, and I'll comment on that. Yes, we have begun some of that work. Crystal, you can talk about some of her context there as well. But yes, we've already actually run several of those sessions.
I'm happy to answer any specific questions, Dr. Thompson or anyone else. But yeah, we're getting some exceptional feedback from all the different stakeholders associated with psychedelic medicine use, so that we can kind of inform this collaborative development of surveys.
Great, thank you all. And I did just want to quickly highlight that these are all very important considerations, and did want to include that in Senate Bill 290, there is a confidentiality provision built into the Natural Medicine Code that is limited, though, to information the Natural Medicine Division receives from licensees. So, for example, if we were looking at coordination and partnership and collecting data from participants and healing centers, information we receive from healing centers, we would be required by statute to keep confidential. So that's also important to keep in mind as we think about what this framework looks like and how we go about this collection work.
But if there was a problematic healing center or facilitator, there's still a possibility of going back and providing additional education or demanding additional education. Is that right?
Yes, absolutely.
Great. Let's go to Mason, please.
Thank you. My question is, Dr. Monte and Crystal mentioned that what's most important to them is what the customer wants. That's what's most important to you, is what the customer says they want. And so I was just wondering if what they want is a purely opt-in program, not, where there's no data collected unless they opt in, because it sounds like you're suggesting some base level of data that clients have no choice whether it's collected or not. That was very controversial in Oregon. And it was very clear, I can tell you, that the consumers and the service center operators in Oregon don't want mandatory data collection. So if it turns out that is what is wanted, would you support that? Because you mentioned trust. It seems like there would be no better way to engender that trust than to respect client autonomy, allow them to opt in. And I also haven't heard any discussion of the risks of data collection and sharing, which I'll have some comments later on about that. Thank you very much.
Yeah, Mr. Marks, let me address that. I want to make sure that you understand my opinion. I think that what consumers want is important, but actually what's most important to me is maximizing benefit and minimizing risk, right? Like that's actually what is most important to me as a physician as well as a medical toxicologist. That is Rocky Mountain Poison and Drug Safety. That's our vision actually, is really to maximize benefit and minimize risk. So that I think is number one. To your second point is, I would say that there are data sources that are going to be available regardless. And so your question is really quite nuanced, and it really depends upon the data source. The law already has mandated some of these data collections, and the state has things on crime stats as Dominique and Allison have outlined already. They've discussed this concept around behavioral health, adverse drug events, and consumer protection claims, and so those are things that are outlined in statute within the law. And so I
just to be clear, those are not mandated. It just gives the agency authority. So it's incorrect to say that that's mandated in statute. Just to be clear on that point.
Mm-hmm. Yeah. So I just would say that I think that we would all hope to maximize benefit and minimize risk, right? This stuff is outlined in the bill there, and so we can sort of talk about what the details are on that. I think if we're working towards the same goal, which is maximizing benefit, maximizing safety, then I think that we'll end up in the right place. Hopefully that answers your question.
I would
Not
just
really. Thank you.
It's incumbent on us to persuade the public. I would just add that it's incumbent on us to persuade the public that this is in their benefit, in their best interest, and it is a program that they will want to participate in. And I'm confident that we can do that.
Thank you. And also just want to be clear here that with the presentations and suggestions that are that have been raised, is that nothing has been determined around this. This is all still exploratory for us. We want to understand what various organizations and groups are contemplating and where there could be opportunities, but this ultimately ties back to our department expectations that are directed by the General Assembly. So just want to be clear about that, that there's no suggestion that what has been presented is the direct path that we are headed down, because I know that includes some suggestions that were displayed and discussed in the presentation. Just appreciate opportunity to make sure that we're looking at various avenues, but also importantly, as has been raised, understanding the risks. What does the law specifically direct? What are the limitations around that? And how do we approach this as a state in a way that is consistent with the directives and ultimately protective of the information that we are expected to gather and report on?
Hi, I am Kasara Andre. I am, for this comment, a practicing veterinarian in the state of Colorado, but I'm also a veteran. So I'm curious either if someone can comment on, or maybe it's just a log the question for later, how some of this data collection will play with other data collection. So what a VA appointment might require. I have a state license as a veterinarian. I also have a DEA license, which is federal. And occupy several positions that require a background check. So if anyone has comment, I'd love to hear if we know how those will play together, or just again, like some questions that arise for me.
Thank you, Doctor. Yeah, and just from my perspective, I can't say that I have, specific answers to that at this stage, but what you just raised are really important considerations for us to make sure we're taking note of, and that be a part of this overall plan that we need to establish around data reporting.
And probably just addressing them as we're
Yeah.
thinking about people opting in or out. Those would be just the big questions that I would want just myself personally considering to have addressed in like an info sheet.
Great idea.
We'll go now to Rita.
Hi, my name is Rita Tsaluk. I'm CEO of Yuma Way. We're a cannabis company. We're planning to be in psychedelic market. We have Cheshire Corner as our YouTube channel, and I'm actually ex-computer programmer with 15 years of experience. I've been thinking about data collection a lot. I think it's extremely important, but it is like everybody else saying, a lot to consider. But if there is any chance to participate in discussions, brainstorming, understanding the data, we would really like to do that as a company and me personally.
Thank you, Rita.
Someone who's coming up as befriend.
Yeah, that's my actual name.
Oh, thank you.
Yeah. I'm a minister here in Oregon, where we are going through the whole legalization process. And I've talked with many people who have trauma, and mandatory opt-in is re-traumatizing. And I think people really need to understand that. To make someone do something in order to get help that they don't want to do is absolutely re-traumatizing. So please keep that in mind as you go through this process and you think about what opt-out really is and what opt-in really is, because the ethics of this are opt-in is opt-in. We went from no means no to yes means yes in a different realm, and we need to catch up really quickly in this realm. Yes means yes, not well, you have to, otherwise you don't get to do it. So thanks for hearing my comments on that.
Yes, thank you. Andrew.
Hello, my name is Andrew Yora, and I'm building cybersecurity software companies. But lately I've been volunteering my time here in Oregon to help the program get off the ground. I'm also a community advisor for OHSU and their psychedelic research program. I'm hoping y'all can avoid the disastrous mistakes we had in Oregon with SB 303, which was our data collection bill. There are two topics we're covering here. One is good psychedelic research to broaden the field and advance science and all those great things. And the other is managing and monitoring the program safety and efficacy. And I'd really encourage you to separate those. To measure the program safety and efficacy, Dr. Monte's program seems like a great program, using a mosaic of data sources, not necessarily collecting data from service centers, but using these existing data sources, combining them in a novel way to truly measure the program's efficacy. Meanwhile, Dr. Thompson's program is definitely a scientific research program. That's one that should be done with informed consent. It should run through the IRB, and it should not involve any data mandate. In Oregon, we tried to mix those two. We ended up with no mosaic data sources, so we're really not going to have a good program. And yet we ended up with this pretend research that's not really research, but scared communities of color and other marginalized communities that have historic trauma with government mandated research. So would really encourage you to separate those out, fund the research at UC Health, give them the opportunity to go work directly with service centers, do their surveys, that sort of thing. And that's all voluntary, that's all informed consent. Stay away from data mandates, keep the data off government servers. If you're going to have detailed data, leave it in the hands of research that have federally certified servers that are protected from federal subpoenas. And as soon as you get the state involved in Oregon, we were collecting massive amounts of cannabis data, and the minute the presidential administration changed in 2016, we repealed that and prevented cannabis dispensaries from capturing that data, because we know data in the wrong hands is dangerous. So keep away from data mandates. Also, there was one suggestion about using this data and selling it to non-academic, non-public researchers to fund the program. Please avoid that. Please don't sell out Coloradans' data to fund these programs. Instead, provide true research grants that will help this program succeed and give us novel research. And I look forward to OHSU and UC Health to work together to do real science, but protect Coloradans and don't sacrifice their data. Thanks.
Thank you, Andrew. And Befriend, I just wanted to touch on the language in the bill again around data collection. I know there are a couple of sections that touch on this, but where we started in our presentation, it provides a state licensing authority, so that's the Department of Revenue, in coordination with other relevant agencies, shall request available and relevant data concerning, and then it goes into these various categories that we touched on in the presentation. I know there are other data sections throughout, but wanted to just refresh our memory on that too. So we're going to look to take no more than maybe 2 more questions and then move on to the other part of our presentation. So we can go to Noah. I know you have your hand up.
Hi, I'm Noah Novello, represent Friday Ventures, do analytical testing, potency, and microbials for psychedelics. I just wanted to agree with the opt-in for the data collection, and think all the points for collecting data are good, and wanted to add or suggest something like the mystical experience questionnaire, and taking in information about the product, the specific strain, and the preparation method and route of administration. Will really help dial in that standardized dose that we want to create. Thank you.
Thank you.
Yeah, and our last comment will be Heidi Pendergast.
Hi, everyone. My name is Heidi Pendergast, and I'm the Oregon Director of the Healing Advocacy Fund. And I wanted to just share a few of the challenges and lessons from Oregon around data in hopes that Colorado can build upon what we've learned here. So for Oregon, neither Measure 109 nor the rulemaking process built in any mandatory reporting for this groundbreaking program. And as the program started to roll out, the importance and urgency of collecting baseline data became very clear by the day. We had no way to answer basic questions, such as what is the total number of people who have received psilocybin services, who's actually accessing these services and why, and what's the prevalence of adverse events. So that's why we helped pass Senate Bill 303 in June of this year, which requires aggregate level data reporting on program use, service averages, and adverse events. But Senate Bill 303 doesn't go into effect until January of 2025. And collecting de-identified aggregate information on service averages and adverse events for all clients is essential to better understanding and contextualizing the number of the diverse events. We do have client opt-out provisions in terms of demographic level data. But right now, we know that adverse events are already occurring, and they're occurring at an unknown rate within the Oregon Psilocybin Services Program. And I work directly with many service center operators and facilitators in the state, and they are also very concerned about the major safety issues and not being able to contextualize and understand this. Colorado has a huge opportunity right now to incorporate this data as a foundational element from day one to evaluate safety and equity of your program. We encourage this with all state programs that move forward. Oregon's scope is smaller than Colorado's. We are situated somewhat outside of the medical framework. And there's a huge opportunity to go further and support de-identified data collection from the onset, again, to better understand access, equity, and program impact. And we're certainly looking over to Colorado as well to lead the way in this area. Thank you so much for your time.
Thank you, Heidi. All right, so we can thank you for Dr. Monte and Dr. Thompson for your presentations. We very much appreciate the time you've taken to prepare and present that to us and all of the attendees here, as well as to all those who had questions and comments. We appreciate from just our regulatory experience how critical it is to make sure that we are bringing diverse perspectives together to inform our work. So we want to make sure that we are fostering an environment for that. So thank you all for your contributions to this discussion. We are going to be focusing now more on the education campaign work that we have ahead. So I'm going to jump into some content here. We are using today's session to continue our conversation on the legislative mandate that you see displayed, directing the Department of Revenue to develop and promote accurate public education campaigns related to the use of natural medicine and products, including public service announcements, educational materials, and appropriate crisis response materials. We had a previous session on public education campaign materials, and I just want to, as we did around the first responder meeting, want to recap some of what we covered in the previous session. So I'm going to hit on some items here from the last session. Again, that last session was recorded, as are all of our listening sessions are available on our website. So please look to that information and those recordings to get the full scope of what we covered there. So I'm covering more on a high level. We did provide educational resources, some links to that mostly based on what the work we've done in cannabis, recognizing this is different, but what can we take, what lessons can we learn, and how does that inform our work around developing an education campaign or campaigns around natural medicine. And that includes resources developed by our partners at the Department of Education, Department of Transportation, like what is microdosing and am I safe to drive? The Colorado Department of Public Health and Environment, as well as drug science. So this is based in the UK, has provided medical psilocybin educational resources as well. So we had provided those materials just to inform conversation in our last session. We had some discussion topics, including looking at target audiences. What are the most effective resources for purposes of public education? What existing resources are out there, if any, and what are those gaps? And then technical needs, things like literature review that needs to occur to inform accurate data. What subject matter expertise is out there to inform how we approach this work. We touched on our division approach, initial anticipated initiatives around this, thinking around compiling existing resources that are out there around natural medicines, recognizing there are going to be some limitations around this, and creating a central repository on the Natural Medicine Division website for transparency and public access. Looking at, because the personal use provisions are already in effect, looking to start there as an initial focus. We've touched on in previous sessions, like a know the law sort of resource, and how do we break that up in a way that can reach different audiences? So really looking to start there. We heard a presentation from our partners at the Public Health Department around their work related to fentanyl awareness and education campaign that is currently underway. And they shared some of their initial experience, and that was the presentation from Sam Borden and Heather Linked-Bergman at the Public Health Department. And Sam Borden is within the overdose prevention unit at CDPHE. So they covered an overview of the work that they've done to implement this campaign that was authorized under Senate Bill 1326, and that was in 2022. Focused on informing communities about fentanyl, laws around possession, responding to overdose, evidence-based practices around accessing treatment and responding to circumstances of overdoses. They touched on some examples of the initial work that they're engaging in, starting with identifying subject matter experts in the space, partners in the community. So that includes harm reductionists, medical providers, first responders, those who have lived experiences with using these substances. And I appreciate the mention of incorporating a myth busting element to the work that they're doing, considering the range of information that's out there, some of which may not be accurate. So what are they doing to make sure that that is a part of the overall assessment? Strategies for audience and community engagement. They had examples that I'll touch on here, advisory groups and work groups, audience research that they're engaging in, And then they provided some insights around their objectives for their process and partnerships that they're looking for in this campaign that they're developing, including with a focus on authentic inclusion of individuals with lived experiences and really incorporating anyone involved as partners in this work through focus groups, in-depth interviews, message testing, and creative development of materials. Having them partner as well in conducting interviews, facilitating the work groups that they're looking to hold, and conducting outreach within their own communities is a valuable approach. They also touched on beyond developing things like toolkits and newsletters, initiatives that could include really directly engaging across the state and within communities as a really valuable approach. And then seeing how that informs engagement by those communities to help with messaging as well for those within their own communities. CDPHE had also touched on communication methods and things that they're doing to reach audiences. They touched on the broad statewide approaches like television, radio, digital advertising, as well as considerations around audiences who may not be as easily reachable. So what are we doing about that? Through conventional channels. So what sort of other approaches should we be considering on that front? And they also mentioned establishing key performance indicators to measure and track the progress of that type of work. We also heard from Ian Sieve in the governor's office, who touched on cannabis education campaigns, providing historical context on the work that has been done in Colorado, reflecting on tactics, historical tactics like Just Say No or the DARE campaign, and issues that have been identified around that. And rather than focusing on what not to do and what you can't do, is looking at an approach of shifting that to what you can do. And so referencing the Good to Know campaign that was displayed and played during the presentation. He also had called out some other campaigns, including Protect What's Next, that involves goal setting. Responsibility Grows Here, including a campaign around Meg the Bud Tender, which provided helpful messaging around things like safe storage, as well as talking tips for adults, talking to children, and marijuana and pregnancy. And so valuable resources that we could look to just understand the range of ways we can look to approach work here in natural medicine. And then we got a lot of really valuable feedback from stakeholders following these presentations, including other considerations around target audiences. So healthcare providers, so the healthcare provider community, and focusing on safety elements and potential risks. Animal owners and individuals working with animals. We had a lot of great context around that. So examples included mitigating risks with proper storage, just as messaging touches on proper storage to prevent access to youth. Animals present during a human's experience with natural medicine, service animals, and the ability to still do trained work during and after a human's experience. Pet poison control resources, preventing dosing of animals and seeing that as inappropriate. Trained therapy animals is another area, and understanding that the likely need for training to ensure that therapy animals are equipped to respond to situations involving a human psychedelic experience. We also heard about recovery clinicians and peer support groups, including mental health and behavioral health providers and peer support groups. Veterans with the trauma experiences with veterans, there was a mention of the need to really prioritize this focus in our work. We heard from a pharmacist, and that is a resource and area of focus as well. And then peer-to-peer education. So empowering individuals to educate one another, those with lived experiences, and reflecting on how distributing harm reduction information in communities with those who use substances and who can support and educate others with similar lived experiences, and a lot of value around that. So we've really appreciated that feedback. Just to close out this recap, Other considerations that we heard based on stakeholder feedback include the safety profile of natural medicines. We continue to hear that emphasized. Engagement with Indigenous community members and experts is really important here. And tied to that is a recommendation that material should consistently include historical context regarding practices related to natural medicines and what may be some current perceptions of, what are drugs compared to medicine based on historical, spiritual, and religious use. Mental health benefits informed by growing bodies of research. Importantly, materials in multiple languages, making sure that we're thinking about that and developing that, and partnerships with other organizations. Identification of experts. This was interesting and a good flag of how are we defining expertise in this area, and how are we transparent about our, how we're approaching that. And then finally, engagement with local governments to educate on the new law. So we had so much great feedback from that last session and want to build on that work. I touched on some of already the anticipated approaches that we're contemplating here by beginning, just as a starting point with creating awareness around what is currently provided under the law. There'll be other things that we'll be looking to do. And that includes, and this came up in the presentations and some of the dialogue was, how are we addressing or tracking frequently asked questions, and how are we being responsive? And if it's not within our lane or expertise, where are we going to look to support answers to those questions? So we're going to jump to, with the time we have here, a presentation, just running through our discussion questions. That's all right. Okay, great. So just it's on the agenda, but want to recap here what we are looking to dive into today, and not being constrained by this, just based on a lot of what we covered already. I imagine that there is additional feedback beyond just the questions, some of which we began touching on in the last session. So one, what sensitivities should the Department of Revenue be aware of when we're collecting data? What measures can we put in place to mitigate any participation concerns? So that was some of what we've already heard comments around. How can the state incentivize participant and facilitator participation in data collection efforts? Again, another area that we already heard some discussion around. What types of considerations should potential participants think about in determining whether to pursue personal use of natural medicines compared to participating in the regulated natural medicine program with a facilitator? What initial steps must occur to ensure education campaign materials appropriately address potential risks and benefits associated with natural medicine? So for example, studies, literature review. So we'll ask for anyone who's interested to provide input or comment on this discussion to please raise your hand, either using the raised hand function, or if you're in person, just raise your hand. When you do, we'll ask you to please just introduce yourself, who you represent, and then we will go from there. Do you want to get us started?
Absolutely. Thank you so much. My name is Dr. Casara Andre. I am a practicing veterinarian here in Colorado. I'm also a veteran, as I mentioned before. Dominique, thank you so much for that summary. That was exceptional. I actually just wanted to make one quick comment on a correction for the record. I believe you're referencing a comment that I made about inappropriate guidance given by human therapists for animals to receive microdosing. And that we feel is very inappropriate, very far out of scope of practice. From a veterinary perspective, we do feel that there is therapeutic potential, different from the conversation we're having for human regulated access, but just to clarify that point. And then last piece that I will bring up, the ASPCA, which is our veterinary poison control, for the first time ever, has listed recreational drugs as one of top 10 pet risks. March 2023, listing hallucinogenic mushrooms among those. So definitely just increasing in exposure.
Great, thank you. And thank you for the clarification as well. And I had intended to say as much that if there was anything I touched on that required either clarification or wanted to expand on, please, if it sounds like I touched on a comment that you made, want to make sure that we're hitting on that accurately. Thank you.
Thanks. We'll go now to Mason online.
Thank you so much. Just one thing I wanted to correct. Heidi Pendergast made a statement about the Oregon SB 303 data collection bill. As far as I can tell, she and the Healing Advocacy Fund are the only people that interpret that the way she stated, as if there's any required data collection. Everyone else believes that it's entirely optional, including the Oregon Health Authority. Anyway, I'm Mason Marks. I'm a law professor. I teach about privacy law and drug policy and psychedelic law. These opinions I'm stating are mine alone, don't represent my employers. I really want to encourage you to involve privacy law people in this conversation about data collection. So I have full respect for the physicians that we heard from earlier. You know, I think clinical research is important, but they do have an interest in maximizing data collection. And you can see that in the excitement that they have about this. And that's fine. But if you really do want to encourage diverse perspectives, get some people that actually understand the privacy risks and privacy law. And I'm going to send you some names and articles you might want to consider, including articles by Danielle Citron at the University of Virginia, Paul Ohm at Georgetown, Michael Frumkin at the University of Miami. The advisory board has expressed interest in recommending optional data collection. And I hope that you do create a program that's truly opt-in, truly optional. And clients should not be denied service for declining to opt in. I mentioned I didn't hear any discussion really of the risks to clients, and that really concerns me. Data collection poses legal, social, and occupational risks to clients. The data could be extremely sensitive due to the disinhibition that psychedelics cause, and it constitutes evidence of federally illegal activity. And if the data gets out, and it likely will, because unfortunately data breaches are common, they're a reality now, it could seriously harm clients. They could lose their jobs and other opportunities. De-identification is inadequate protection. It's fairly easy today to re-identify data. Collecting only aggregate data could help, but it must be very clearly defined and only include sum totals of certain client traits. There's been some confusion also on the advisory board about HIPAA. The Natural Medicine Health Act does not apply HIPAA to client data. It requires only that client data be considered medical data for the purposes of excluding it from public records requests. So I've heard that misinterpreted by the board. Even if HIPAA did apply, it would still be inadequate protection. Federal agencies are considering ways to improve upon HIPAA because it's outdated. I mean, HIPAA was created before we had the internet as we know it today and before electronic medical records. So you should be thinking about that as well. How do you go beyond HIPAA when it comes to protecting client data? And then I just think the most important thing I'll say, if data collection is mandatory, that's going to create some perverse incentives for people to avoid the regulated system entirely. Or they might provide inaccurate information. If they know that they're required, if their data will be reported by mandate, they might be less likely to report adverse events or to report things like suicidal ideation because they might not want people to have that information. So you're really just creating incentives for people to use the underground program, which maybe that's not bad, but if you want to encourage people to use the regulated program, and trust really is important. I think the best way to do that is to make it voluntary, because I think many people will contribute their data, and it's just not true that it needs to be mandatory to get valuable information out of the program. In any case, thank you very much. Appreciate the opportunity to discuss this.
Thank you, Mason, for raising what you have here. And I think for us, what you flagged is something important for us to take back and consider. What other subject matter experts are we bringing into these conversations around the data analytics perspective, as well as privacy law experts around this type of work, so that we can really further assess the various risks associated with data collection and reporting. So really appreciate that, and the examples that you provided on the various impacts, risks that could come into play, impacts on somebody's employment, other licenses that somebody holds. So really critical stuff that could really affect people's livelihoods that will need to be central to this conversation. And as it relates to the expectations around what is mandatory for reporting, or collection. I did touch on the language that we had referenced at the beginning of our presentation that was around an expectation that we as a department are requesting information. So I'm not reading that as our needing to mandate providing certain data, but we are mandated to report certain available data. So there's more that we're going to need to flesh out around that. And also understanding that there are recommendations that will be coming from the advisory board around this to inform this work as well. So we're going to look forward to really bringing all of that together to inform even more robust discussion around this.
Thank you. We'll go next to Tasha.
Hi, thanks, Dominique and Allison. My name is Tasha Poinsett. I am with the Healing Advocacy Fund here in Colorado, State Director. And I wanted to comment in part because I feel like we've been getting a lot of comments from out of state, and I wanted to make sure that we have some comments coming from folks in Colorado. And so I really would echo a lot of what was shared in the two presentations at the Healing Advocacy Fund. As Heidi kind of shared to some extent, we think that robust collection of information on the program at a high level is just really essential to safety, equitable access, and then also long-term sustainability of the program, as was highlighted by our previous speakers, trying to contextualize the proportion of adverse events relative to the total number of people accessing services or participating in psilocybin sessions. And so I think numbers along those lines are what was envisioned as mandatory in SB 303. And I think we're really seeing the importance of that even at the onset of this process in Colorado. So with the Healing Advocacy Fund, we've been doing a lot of outreach and having conversations with people across a lot of different communities, and people are really interested to hear what's happening in Oregon. And it's a pretty significant barrier to our understanding the program that they aren't even able to report numbers of people who have accessed services. That's just such a kind of clear criteria that I think should be included. And it's hard for us to know exactly what's happening there and to be able to learn from them when we have to estimate. So right now, our team is participating in putting together these estimates, and we estimate that over 500 people have accessed services, which is really incredible, I think, especially as you consider that in the context of what Dr. Thompson was sharing, that the number of people accessing through clinical trials might be in the hundreds. So that's really significant. And I think that those high level data points that aren't identifying in any way, nobody can personally be identified from a number that's an aggregate number of people that have access services. So things along those lines, there should be consideration of what is the baseline for reporting to the state so that everybody who's looking at this program has access to the information that they need to evaluate basic safety parameters. And then there's a distinction, of course, with other types of sensitive information. Opt-out is absolutely appropriate. And so I think that the state just needs to be really careful in how they're considering this and making sure that those high-level numbers are captured in reporting from the onset of the program.
Thank you, Tessa.
Any other comments?
And recall both on either data collection initiatives that have been a large focus, as well as our education campaign related work. We welcome any comments.
While folks mull over any other final thoughts they may want to share today, I think we've touched on it throughout all these meetings, but it's always worth reiterating that this is going to be an iterative process. We are only at the very beginning of implementation of Senate Bill 290 and our work here. So keeping that in mind, there may be ideas that are appropriate to try or to hold off on and get further information before we explore other opportunities. And so if there are thoughts about where we should be prioritizing initial implementation, future implementation, we want to hear it all.
And if there aren't any additional comments, we don't need to keep folks longer than necessary. We look forward to plenty of opportunities to engage stakeholders throughout this work. It's going to be really important that we have our stakeholders energized to help inform this work ahead. So while we are looking for any other hands, I'll start touching on some of the next sessions we do have coming up here, and recognizing, with the holidays as well, that that will create likely some limitations on participation. We've really appreciated, as we have provided hybrid options to attend in person as well, that we are seeing attendance in person. It's nice to see, and look forward to that growing, and we're going to continue to provide that option as we are able to. So with future listening sessions we have coming up, the next one is December 11th, and that on December 11th, we're going to be focusing on, again, cultivation and manufacturing practices. We did have a previous session around this, a lot of great discussion that we really need to dive further into. So look forward to that. We similarly will have a recap on the previous discussion we had, so that can hopefully inform more robust discussion around practices related to cultivation and manufacturing that will inform other regulations that we might be contemplating and want to bring to the table for further conversation. And that one is going to be a hybrid. We'll have the option for in-person attendance. And then on December 21st, this will be virtual only, recognizing it's close to holiday time. We're going to be focusing on, this is a new one, business structures and licensing. So different topic that we will look forward to diving into, that will be more specific to as well our regulatory program, and what that application process, licensing process is going to look like. What lessons learned can we take from the work we've done in cannabis? Where do we see streamlining opportunities we're currently engaging in around our cannabis program that can inform starting as simply as possible with a licensing program for natural medicine, and not just saying, okay, this is what we've done, so we're taking this and putting it here. So we really want to make sure that we are taking lessons learned and leveraging the stakeholder feedback we have to stand up this new licensing program in a really effective manner. So do we have any other hands? Otherwise we can look to.
Yep. Oh, Noah, you snuck in. Go ahead.
You're muted, Noah.
Thanks, just in time. I just wanted to comment about some of the initial steps to ensure the education campaign. I think really educating people about the potency and the milligrams of the dose, and kind of getting that established will really help people understand how much to consume and how not to consume too much. And really teaching people about the dosing, because it's really, it's all over the place with different strains of mushrooms and extracts and products. So really standardizing that dose size and getting that information out there, I think is going to be an important first step. I also want to comment that any educational campaigns that are going through the board, that they get vetted, and that people are able to recognize that the information is coming from the state, and it's been vetted. I've been to a lot of public meetings that have presented a lot of misinformation about psychedelics. And it's, to a room full of people sometimes who are just, really seeking that education. So somebody who's seeking that education, they're able to easily recognize that the information is coming from, good source, and it's provided, by scientists and with data and lots of background. I think that's important to have. Thanks for listening.
That's great. Thank you, Noah. And important points. And just something I also want to mention based on what you've shared is related to where we should be thinking about content for education campaigns. You mentioned, potency and, dosage is recognizing there maybe being limited literature around that. So, and resources around this. So we're looking to more input around where we should begin around in this area is thinking about the types of products that are out there that we can also contemplate potentially being a part of the regulated program, where we're going to need to contemplate regulations around what are permitted products that can be manufactured and made available for facilitators to provide participants, and where should there be certain restrictions around that, and also keeping in mind the importance of our needing to keep it to focus on preventing youth access, and a lot of lessons learned in cannabis along those lines too. And so welcome additional feedback from stakeholders around what other information we should be looking to inform this type of work around potency, dosage, because we'll need some help around that.
If I may.
Please.
Great.
Thank you. My name is
Yeah, I'd be happy to
Elizabeth.
provide.
Thank you, Noah. All right, please.
My name is Elizabeth Cook, and I just wanted to piggyback off what Noah was saying and what you had commented on potency, but also the strains, because in cannabis, the strains, they're very different, but they don't have vastly different effects, except for one might make you a little bit more tired, etc. But with mushroom strains, some can really have stronger hallucinogenic effects, and others more spiritual effects, others give you the giggles, so depending on, I think, public information, and that, because I've gotten a lot of comments about how scary it is because you don't know how this one's going to affect you or that one. And so that's where I would really welcome a lot of information there, and public information.
That's great. Thank you.
Please. One thing that I was thinking about earlier, and it's kind of come back around, is with the data collection is, the worry that if we, I don't know if this is the right word, but like diminutize the data, make it too granular, that it will start to lose the meaning. And we can make a lot of false assumptions by doing that too. And that, I believe, a more holistic view is going to be required. Like some imagination could be required that this dose that I take could affect you. You're my same height and weight probably-ish. We could have totally different outcomes, right? So I think it's just important for us to remember that, this is what I was just thinking, if we just say, hey, it has benefits for a lot of folks that have depression, they're gonna think about an antidepressant and how that works, but that's not how this works, right? It's a process that can be challenging, and that can be the outcome. But this all looks very different depending on our backgrounds. And it's a totally different way. I'm just worried about, I'm totally interested and want to be part of the data collection piece. I'm worried about making it too granular that we can't use it or meaningless.
Thank you for that. And I think even considering as we look to develop materials for purposes of public education or partnering with others who are well equipped to do that is, where do we need to provide context like what you just touched on around distinctions that anyone should be considering, and also from other comments we've heard as we develop materials, where are we identifying the sources of this information as the basis for why we have something presented on certain materials will be really important, so that we're getting ahead of questions and also providing that appropriate basis and transparency around that.
Mm-hmm. Well, thank you everyone who joined us today. If you found yourself in this session but do not receive our emails, please use the link I put in the chat at the beginning of the meeting to sign up for those notifications. That's how we communicate when our sessions are happening, the agendas, as well as other important updates as we move forward into 2024.
Thank you. And we look forward to seeing you all in our upcoming sessions. Again, December 11th, we will be providing an in-person option for that and focusing on cultivation and manufacturing practices. And then December 21st, virtual only, talking about business structures and licensing. Thank you all so much for your contributions today. We look forward to continuing our work with you. Have a wonderful day and week.
Thank you.
Thank you.